So hello guys, welcome back to my YouTube channel. This is your favorite Kudus. On today's episode, I'm going to be talking about HIV/AIDS in Nigeria, and not really like in Nigeria, but in Africa generally. If you're a new subscriber, thank you for stopping by. Thank you for watching. But one more thing, you need to subscribe, like this video, comment, share, and turn on your notification bell and get notified anytime I post any new videos. So if you are also a subscriber, thank you for watching back, thank you for coming back. I know you really love me so dearly. But without wasting much of our time, let's get right into the video. I love you guys so much. Number 2 I have on my list is blood transfusion, organ transplants, and body fluid. I used to tell people you have to be very, very vigilant when it talks to health, because a lot of people, let me say, I don't really know, maybe they take advantage, or let me say they take disadvantage, because this thing is life threatening, and a lot of people got depressed and about HIV, AIDS, and all. So these are another ways you can get HIV. So you can get HIV through blood transfusion if your blood is not well screened. Especially people working, or probably maybe you've gotten a blood in the hospital before. Make sure that's why I used to talk things about Nigeria. We need a good regulatory bodies, but I guess they are improving anyway about this blood transfusion stuff, and I guess it's improving. So through organ transplants, so you can get HIV through organ transplants. Then at the same time through body fluid, yes, of course you can get HIV through body fluid. The another thing I have on my list is also hazard, and hazard can be in form of clipper, sharp objects, or piercing instruments. Especially people that want to tattoo your body, so you make sure these things are well sterilized. And we all know that hazard, we have the chemical, the physical, the biological, and all type of hazard. But the hazard we are talking about here, it might not really, probably maybe you go to the barbing salon, you went to a stylist to style your hair, all these things, all the instruments are not well sterilized. You can actually get through HIV through all these things. But you might be thinking probably you are getting it through sex. No, that's why I brought out this video to you guys, to learn and to eradicate our thinking that HIV is not only getting through sex. Yes. Another thing I have on my list is pregnancy and breast milk. Yeah, HIV can be inborn. So we all know that HIV can be inborn. So another thing I have on my list is barbaric cultures and social norms, and it can be traditional holds involving exchange of blood as a sign of love, of true initiation to cults. So these are another forms of way you can actually get HIV. There are some cultures that they are barbaric because they don't exist anyway. To me, I don't think they exist. Because how you say you want to make an oath for love, you have to pierce your hand with blade, lick it because of, no, that's very wrong. That's a wrong practice. That's a very, very wrong practice. So if you are formed, or you are kind of person that does all these things, you need to stop all these things. Using of unsterilized instruments, like I said earlier, all these piercing instruments, then high risk of STIs and STDs and other infections like syphilis, gonorrhea. So when you have high risk of all these things, you are prone to HIV. You are treating it every time. It's not really HIV. You're actually prone to prostate cancer at the same time too. So take your health very, very important, because STIs and STDs sometimes they multiplicate. So if it is not well treated, you can treat it this month, 3 months, 4 months, this infection comes back. So when you have high risk of all these things, you are prone to HIV/AIDS. Then another thing I have on my list is female genital mutilation and male circumcision. When babies are small, male, they circumcise their penis, and in some states like Oyo State now, for example, they circumcise their female too, some to prevention of HIV. We've talked about how we can get HIV. Now let's come to the prevention. So I will be dividing the prevention into two anyway. So let's just quickly get into it. Safe sex. That's using the ABC method. A means abstain from sex, B means be faithful to your partner, and C means use of condom. So avoid sharing of skin piercing instruments. Don't say because I love this person. Yeah, avoid sharing of skin piercing instruments. Even if you have to have any tattoo on your body, you make sure the instruments they are using are well sterilized. Advice to people visiting the salon. Yeah, I used to tell people visiting the salon to get your own clipper, or if you are like, okay, let me say, if you're an hairstylist, you like out, like, how would I put it? You are this kind of person that like displaying hair every time. Make sure you get all these instruments like for yourself at home. So when you are visiting the salon, you carry your own instruments to the salon, like your hair comb and other things. All these females now. So proper screening of blood transfusion. I've said earlier that government needs to like work on this thing very well. Appropriate protective barriers, especially with people that are working in the lab, the medical lab sciences. You make sure you wear your gloves, you make sure you wear your coats, you make sure everything is in place, and you wear your head, you cover your head with something. Personal hygiene. Personal hygiene is very important. So anytime you touch the surface of anything, you make sure you wash your hand and you sterilize your hand. Proper sterilization of instruments. Yeah, as I said earlier, all our instruments need to sterilize, especially people that work in the hospital, doctors. Make sure all these nurses sterilize their instruments very well. Then adequate cooking of our food, especially meat and fish. Yeah, if some meats are not well cooked, you see that there's still tendency of you seeing blood in it. So welcome back, guys. Welcome back. Yeah, I'm so funny anyway. Yeah, because I have to make this video interactive and you guys need to gain one or two things. So talking about the origin of HIV is, a lot of scientists has really worked, and still yet the cure has not been invented. But we have to play safe. I used to tell my clients and patients at work and dysphoria. So today the things I want to talk about is how is HIV gotten, like how can you get HIV. The first thing that used to come to people's mind when you say, okay, the person is HIV positive is can be through sex. Yeah, because let me say 80% the incidence and the prevalence of having or getting HIV through sex is 90% high, because a lot of people want to engage in sexual intercourse, sexual harassment and all. But number one thing I have on my list is also sex. But it's not only particularly sex, it can be through rape. But let me just put like this. You actually say sex and rape. Okay, how is it transmitted through sex and rape? One is through vaginal secretion, semen, that is your sperm, and through sharing of sex toys. These are one thing, or let me say this is one of the prevalent incidence way of how people get HIV, which is through sex. So it can be through sex or through rape. And these are how it's transmitted. It can be transmitted, like I said, through vaginal secretion, through semen, that's your sperm, and through sharing of sex toys. As I said earlier, that the prevention will be in two places. So the second phase now, I'm going to talk about PrEP. PrEP means pre-exposure prophylaxis, and it can be in form of tablet and shot. That's like it's not like a vaccine but injection form. But most in Nigeria now we don't have the injection form, so we used to probably people used to get the tablets form. So before you can take PrEP, there are some necessary things you need to do. You have to go for retroviral screening and know that okay, you are not an HIV patient, you are not positive. These are things you need to do first. So after doing your screening, you do your creatinine level of your kidney, of your liver, kidney, and all sort of stuff, because all these tests is something you need to do. You can't just start taking PrEP. No. All these necessary tests, they'll have to, because there are some people that their kidney might not be able to metabolize these drugs, so they don't give them PrEP. But Nigeria, once they say PrEP, maybe start just take. No. It has to be a stepwise position. So you visit any nearby clinic and they test you, run all these tests for you and give you the PrEP. So without wasting much of our time, so these are things you might experience while taking PrEP. You can experience nausea, vomiting, color urination, like I said, headache, stomach upsets. So nausea and all these things are very very common. But trust me, this side effect is just for a little period of time. It's not for a longer period. Do you get? Probably like 1 week, 2 weeks, all this side effect stops. Then let me say it is 90% safe when you're taking PrEP, even when you meet with someone with HIV. Yeah, it's 90% safe, but it's only preventing viral infection. It's not preventing. So, like I said about PrEP, PrEP is taken for good 7 days. If you are this kind of person that you had an anal sex, so it's taken for good 7 days for it to start working to reach the maximum peak. So if you are this kind of person that okay, you're taking it for vaginal sex, so it takes a minimum of 21 days for this PEP to reach the maximum peak, like the maximum, like the onset of action to start working. So now let's go to PEP. That is PEP, post-exposure prophylaxis. Like I said about PEP, PEP is pre-exposure. So PEP is just like a prophylaxis. We are taking it against. So when we don't talk about PEP, that is a suppressive medication. Like you had contact with someone, you don't know maybe the person has HIV or not, but you just want to to play safe that okay, even if the person is HIV positive, you don't want to have the virus. That's when you take PEP. That is why it is post. Like I said, I've already said it's a suppressive treatment. Taking this, I also said taking these drugs is for 72 hours after sex. So within the period of 72 hours after sex, that's when you can take these drugs. After 72 hours after sex, the drug is no more. It's no more what you are gone. So like I said, most times you might be having sex and your condom break or you are sexually assaulted by someone that's like rape, which I mentioned about. So it's advisable you take PEP so that you don't get this virus, because every seconds and every hours counts. Like I said, within 72 hours. So after 72 hours, you can take PEP again. So that's why I brought out this video to eradicate this thing and our mentality about this, and to update our knowledge about all these things. And PEP should be taken for 28 days. Don't say because I've taken for a week, I can't take it anymore. You have to complete the whole cycle for 28 days. So within the 72 hours of after having the sex, you have to take the drugs for 28 days. So you are taking the drugs for 28 days. So now let's go with the third one, which is the ARTs. So that's after re-exposure prophylaxis, or some people call it after re-exposure treatment ARTs. So this one is just like the person is already infected with HIV, but you're just trying to reduce the number of virus in your body, the number of virus, the cells in your body. That's the CD4 cells. That's why you see people that are HIV positive, they go to the hospital or the clinic to do the test, because the minimum range of these CD4 cells, so it has been in the minimum range. So once it's above that or below, so all these medical doctors, they consult you and they give you your medication, and most especially you have to be faithful to your partner, as you said, using the ABC method. If you know you are positive, let your partner know, oh, this is it, this, that. So because to avoid story that touch, I used to tell people, so this combination of drugs is used to increase the potency and to reduce the virus developing in your body, like the resistance of this virus in your body. So like I said, and also I used to advise my clients, so even if you are taking any of this preventive medication, the PEP and other things, I used to tell people you can also as well take, I actually said that all these things only prevent viral infection. They don't prevent bacterial infection. So that doesn't stop you from getting syphilis, gonorrhea, or any other bacterial infection. So in order to prevent all these things, people can get, the females, you can get the cranberry, you can get supplements, you can get the probiotic supplement. So likewise other vitamins, of vitamin A, vitamin C, just to boost your immunity, because if you are taking ARCs, and you are not taking all these vitamins to boost your immunity, you are prone to all these tuberculosis, diarrhea, weight loss, shingles, and other things because your immune system is already weak. So that's why I used to advise people, always make sure you are eating well, eat balanced diet, take a lot of fruits, take your vitamins very well. That's very, very important. And at the same time too, we should not stigmatize them because they are HIV or they're positive. That no, we should not stigmatize them. Let's treat them equally. That's very, very, very important. It's very, very important. So if you know this video is helpful, comment, share, likes this video, and always turn your notification bell for more content and updates. I remain your humble Kudos. I'm an advocate for Sustainable Development Goals 3 and 5. So 3 means good health and well-being, while 5 means gender equality. So I'm also a mental health public speaker anyway. So guys, thank you for watching. Thank you for staying back. I really love you so much, and see you in my next video.